I'm Lillian Cow. I'm the Chief of Acute Care Surgery at McGovern Medical School, and I'm a trauma surgeon at the Red Duke Trauma Institute. So our next session is on school-based violence, and our first speaker is Dr. Jeff Temple. He is the John Seeley Distinguished Chair in Community Health at UTMB, as well as a licensed psychologist and the founding director of the Center for Violence Prevention. His research focuses on the prevention of interpersonal, community, and structural violence, and he has been funded through multiple organizations such as National Institute of Justice, NIH, and CDC. He also co-chaired the Texas Task Force on Domestic Violence and has served on the board of directors of the Texas Psychological Association. So let's welcome him.
Thank you all very much, and thank you for putting this together, Rice and Baker and everyone else involved. I also, since I put that together, have assumed the new role of, it's on there, the Vice Dean of Research and Scholarship for the School of Nursing. So basically what that means is that I don't sleep anymore. But I have surrounded myself with really impressive people. The back room over there, if you all could raise your hand. Thank you all very much. They're the reason I have any success whatsoever. Also with Dr. Guillot right here. So I'm going to talk a little bit about the intersection of dating violence and firearm violence, but also talk about how schools can serve as a place for prevention and intervention, and really what we need to do this is policy. So Dr. Guillot is going to follow me and talk a little bit about how to talk to policymakers, how to work with them in getting our ideas actually implemented, so that only, when we write something that not only one other scientist reads it at another obscure university and nothing ever happens with it. So I did promise Liz Torres, who's my associate director back there, that I would say at least once that the reason I wasn't here this morning because I was on NPR talking about the intersection between gun violence and mental health. I think the over-under of how many times I was on the national NPR this morning was about 2, so I'm right there. So first, before going through that, we established the Center for Violence Prevention at UTMB in December 2019, 3 months before the world shut down. And so now when I get to do these types of presentations, I take every opportunity to talk about who we are and what we do. So basically we are, hopefully for the nation, but certainly in Texas, going to be a resource and a clearinghouse for violence prevention. And so when we talk about violence, it's not just dating or domestic violence, but structural violence and racism and discrimination and affordable housing and child care, and basically anything and everything that can be looked at as violence. And I think Dr. Guillot will say something a little bit about that. We have a few core faculty members, one of them over here who's Dr. Guillot, who is now the Vice Chair of Family Medicine, Research in Family Medicine at UTMB, and then Dr. Leela Wood and Dr. Baumler, and we're growing, including a couple people in the audience, Dr. DeMello, Bendy, there you are. So we're growing and we want to be there, a resource for the nation in terms of violence prevention. So please contact us. All right, so more to the meat of the talk. This is me. You can see me in the corner over there. I'm wearing the exact same suit I'm wearing today. And this was the governor's roundtable after the shooting at Santa Fe High School a few years ago. Which incidentally, and Shannon will talk about this, the day before the shooting, Shannon and I were both testifying to Texas House of Representatives about school safety and preventing violence. So it was a terrible coincidental timing. So in this, and with the roundtable, and one of the things that I mention often, and I'll get to this a little bit more in a few minutes, but when we are at these types of roundtables, I emphasize that, you know what, it is a multifaceted problem. When I say it, I mean gun violence. And we're not going to resolve it by increasing police, no offense to y'all in the back, or hardening schools, or taking care of mental health illness. So we want these new legislative priorities in the national conversation are increased services for mental health, increased resources for mental illness. As a psychologist, that's fantastic. Please give us all the resources we need. We need them. We're in a mental health crisis. made worse by the pandemic. We need all these resources. We need this money, but it's not going to do anything to curb mass shootings or really everyday gun violence. It's just not. It'll help with suicides, but it's not going to do anything with mass shootings. So that's the emphasis that I put at these roundtables, and I wasn't invited back. And when thank you. And every time I get a chance to talk is it has to be prevention, it has to be prevention. It has to be robust generational investments in prevention. So it has to be the same way we tackled as a public health problem, COVID, HIV, cancer. We have to do that with gun violence. We just have to. And you know, if you look at some of the studies that have been out there, and I don't know if someone has addressed this already because I was on the national NPR thing talking about gun violence. So if you look at the gun violence as a public health problem in terms of deaths over the past several years, it ranks up there with things like cancer and heart disease. It's now one of the leading causes of death for youth and young adults, the leading cause of death for black youth and young adults. And if you would look at that and the expected amount of publications that we would see with gun violence, it's about 2% of what would be expected given the public health crisis. From funding, it's, 3% of what we would expect in terms of funding for this public health crisis. So we need just tons of money and resources and our full national attention on this crisis. It's not going to get better until we do something like that, and even then it's going to take generations to get better, and there are stuff that we could do in the meantime, and that's what I'm going to talk about here today. So dating violence is sort of how I got into the field of gun violence at all. So we started, I'm going to just jump to this slide right here. It's really hard to read. I apologize, but just I'm going to verbalize it. We started a study in 2010 where we looked at about 1,000 youth in the Houston area, and we've been following them now for the past 12 years and are still following them for the next few years. So when they're 15, just starting to get into relationships, sophomores in high school, now they're 26 years old, a lot of them have kids themselves, are married, and we'll be following them until they're 30, and then hopefully longer if we continue to get money to do that. And we're also including current partners. And so we're looking at this to look at really the risk and protective factors of multiple forms of violence. Initially, I was focused on dating violence. So this is things like physical, which is what you know of, hitting, pushing, pinching, choking, biting. Psychological, which is calling someone stupid and ugly and worthless and fat, and all the while alienating them from their friends and family, which we know through decades of research that sort of psychological abuse is more damaging than physical violence. That, you know, the whole adage, sticks and stones may break my bones, but words will never hurt me, is really stupid and needs to be turned on its head. It's really the reverse. Things like sexual violence as well, and we see the reason I want to focus on dating violence and prevent dating violence is we see this as a first step into future domestic violence and future other forms of violence. And we could even go back a little bit further, and we see things like sibling violence and bullying and homophobic name calling and harassing as all those as predictors of dating violence. So you'll see when I talk about this, we need prevention to start early, be developmentally appropriate, and continuous. So the other thing that we did with this is after Sandy Hook, which was 2013, that resulted, I think, in the death of 27 people, President Obama loosened the restrictions on the ability to research guns. Now, there's a little bit of a misconception that we weren't able to study guns. That's not true. It just wasn't supported financially, and it's pretty hard to do anything if it's not supported financially. So we had a grant through the National Institute of Justice at that time to continue our longitudinal study. And so the day after he loosened the restrictions, we went to IRB and added questions on guns. So gun carrying, gun access, gun use, threaten someone with a gun, being threatened with a gun, how they bought their gun, what type of gun, why they carry a gun, all that sort of stuff. And what we found was pretty interesting, and we also looked at its relationship to mental health symptoms. So I'm changing the course of this talk a little bit. So I was going to talk more about dating violence and the incidence of that, and I will still to a certain extent, but I'm going to kind of blow through these slides a little bit. Basically, the important part of this slide is that by the time that people are in our study, which we think is pretty representative of the nation, is that a little less than half of people by the time they're about 25 are going to be in a violent relationship, some sort of physically violent relationship. And this wasn't driven by just one item. This is across all of the items, and I'm old so I can't see anymore. But if you look at threw something at him, so over the 8 years, 34% had been victimized by that. Punched, 34%. Pulled hair, 29%, and pushed, shoved, or shook, 39%. So this is boys and girls, that violence, this is just to say that violence is a hugely prevalent problem that has really negative consequences. I'm not going to necessarily get into the negative consequences except to show it's linked to firearm violence. And we also know what predicts dating violence. With dating violence, physical dating violence is domestic violence exposure, child maltreatment, and deficits in conflict resolution. So this is something that we put together, a paper where we did an algorithm to look at what is most predictive. So look at the strength of relationships, and that's what we found. Consequences are many. We don't necessarily need to go through all of this. The one thing I will say, and this goes to my theme of prevention, is that it is fiscally responsible. So even if you don't care about kids, even if you don't care about mental health or anything else, it is the fiscally responsible thing to do to devote money to prevention. Because we know that kids who are stressed, who are in violent relationships, they're going to do poor academically. And if they're going to do poor academically, they're not going to have a good career focus, and then they're going to be lousy taxpayers. So we can say even to some of our less kind-hearted friends that it is, that's a way to, you get what I'm saying. I'm going to shut up. All right, so the other really important thing about consequences of dating violence is, again, preventing future domestic violence. Domestic violence costs us, again, going back to this fiscal argument, billions and billions of dollars. So if we could prevent domestic violence, then we can save taxpayers a heck of a lot of money. And to do that, we need to prevent dating violence. We need to focus on teens. We need to focus on elementary school students, middle school students, high school students. The other thing is we know that it is a huge predictor of firearm violence. So if you look at all the mass shootings, so this isn't even counting everyday gun violence. When I say everyday gun violence, I mean gang violence, interpersonal conflict. If you look at that, if you look at those types of mass shootings, or if you look, sorry, not mass shootings, if you just look at homicide, killing of a partner, killing of a parent, it is overwhelming that is what gun violence is responsible for. So getting totally away from mass shootings, school shootings, it is a huge problem. Domestic violence, dating violence. Now, going strictly to mass shootings, we know that, and you can see this study by Geller et al. It's a little bit small, I apologize for that, but over half of the mass shootings from, I think it was 2014 to 2019, well over half involved some sort of domestic violence where it was an actually domestic violent incident. It was spurred by domestic violence. You can look at Uvalde. He shot his grandmother in the face before going to the school. We see this over and over and over again with mass shootings, that there's a history of domestic violence, there's a history of misogyny. So we know that there's a relationship here. So what does that all mean? Well, it means that we need to do a better job of talking to our kids and universal prevention approaches to healthy relationship skills. So I'll say that over and over and over again, is that we need healthy relationship skills. We need to teach kids to be in a relationship. So going to school, I'm going to be done in 5 minutes. And so going to school is important. Schools are overwhelmingly safe. They are the safest, for a lot of kids, the only safe place for them. So I really, obviously school shootings are scary. I have a kid that's a senior in high school, one that graduated last year from high school. I still get nervous when I see these things. There was a scare at our high school a few years ago when I was on the school board and my kids were there, and it was frightening. It was parents pulling up. I get it. It's scary. It's terrible. But schools are not the boogeyman. Schools are safe. They're overwhelmingly safe. Again, for some kids, it is their only safe place, so we don't want to take that away from them. Solution. Now, I know there's police in the audience. I love y'all's work. I serve as the community liaison to our police force in Galveston, so we're working with them closely. We absolutely depend on police for their work, so this is not throwing them under the bus, I promise, especially since they're here to protect us right now, so thank you. But it really isn't. So we need, and something that Dr. Gee and I have talked about is the Children's Defense Fund said that for every dollar you invest in hardening a school, so that has been police force and barricades, whatever, we should match that with $1 in behavioral health. So, and I think that's a brilliant approach, and everyone kind of gets what they want. So another thing, mental health, mental illness is not the cause. So that is going to be another theme that I say a lot. So I'm a psychologist. Again, give me all the resources, give me all the money. If I hired 10 psychologists today, they would all be full in 3 weeks. We need more psychologists. We are in a mental health crisis in this country, in this world, that's made worse by the pandemic. The last wave of COVID is going to be mental health. It's terrible. So I'm not saying that we don't need resources. We do, but it's not. When you look at mental illness, only about 4% of all violent incidents are caused by someone who is mentally ill. There is no diagnosable mental condition that explains mass shootings. There just isn't. Nothing. And if you look at it, thank you. If you look at it, they're more likely to be victims than perpetrators. And it is a politically expedient boogeyman to blame mental illness, right? It is, you know what? I am not mentally ill, so therefore I can't do this. Nothing bad could happen to me like this. Mental illness is scary, and it's crazy, and why would anyone do this if they weren't crazy? Well, how do you know they're crazy? Well, because they did this. But that's not good enough. I mean, if you look at it, it is not. Like, most mass shooters don't even have a diagnosis of mental illness. But even if they did, it's not the cause, right? 20% of us have a mental illness. We're not doing this. So what is the cause? Sorry. It is access to guns. And I know I'm in Texas, and I know that people sometimes don't like hearing that, but that's what it is. We have violent video games in our peer countries. We have mental health problems in our peer countries. We have COVID in our peer countries. We have bad parents in our other countries. We have everything you can think. What do we have that they don't is access to guns. Now, I also live in reality, right? We're not getting rid of the guns, despite what Beto O'Rourke says. They're not coming away and taking away your ARs. Now, that doesn't mean that we can't make some common sense changes, like age changes from 18 to 21. You have to be 25 to rent a car. Seems like a common sense thing to me. And there are other really sensible things that we could do. Safe storage laws, red flag laws. Red flag laws have the really awesome potential to not only reduce gun homicides, but gun suicides as well. And that's after due process, and it's only temporary where we take the gun away. So there are really reasonable solutions to this problem. Now, again, knowing that we live in reality, knowing that the guns are here, even if we make generational investments, they're still here. So I really want to go back to what I said at the beginning, that it's going to require universal prevention programs to target kids from when they're in elementary school to when they're post-high school. And this has to be not just a school assembly. It can't just be a one red ribbon week. It can't be a guest speaker. Those aren't going to do anything at all. They just won't be effective. What we need is real socio-emotional learning programs, healthy relationship programs that start in kindergarten and go every single year throughout the years. And that's doable, and it will work. and we know it works. We've shown that it works. I was going to show you this quote real quick. Where is it? Man, I messed up there. Oh, because it's going forward. Anyway, I'm out of time anyway. We know it works. We've done school-based prevention programs that work in preventing violence. We can't identify school shooters. We don't know what they look like except the fact that they're male and typically white. Other than that, we don't know who's going to be a school shooter. Some of them came from well-intact families. Some of them came from poorly intact families. Some of them got A's in school, some of them got C's, some of them got F's, some of them dropped out, some of them were just there in school riding along, some of them were stars. We aren't going to be able to identify school shooters, and even people that say like, oh well, you know, these kids talk and the kids know who's the shooter and all that, sure. That's at every high school. There's about 100 of those kids. So we can't take all of them away from school. So we have to do, instead of trying to identify and target a school shooter, let's do universal programs that are socio-emotional focused, that teach healthy relationship skills. Best case scenario, we prevent a school shooting. Worst case scenario, a kid that was not going to be violent learns how to be healthier and happier. Thank you all. Okay, you got it. All right, I'm done.
All right, thank you so much. Our next speaker is Dr. Shannon Guillot-Wright, who, as already mentioned, is the Vice Chair of Research and Health Policy in the Department of Family Medicine at UTMB. She also serves as Director of Health Policy Research in UTMB's Center for Violence Prevention. She researches structural violence with a particular emphasis on the use of research evidence to foster equitable policies. She conducts photoethnographic fieldwork, and she's actually a selected artist for the National Academy of Medicine's Visual Health Equity Gallery. So we are pleased to welcome Dr. Guillot-Wright. Thank you. How does this work here? I'm not sure if I was supposed to pull the presentation. Good question. I think someone else. As we hold for technical difficulties. Okay, I'll ask a question while we're holding for technical difficulties. Dr. Temple, so you know, you talked about addressing kids, but so I'm a surgeon, and a couple years ago, one of my colleagues down the street was shot by her husband, and she was, you know, a strong individual, a surgeon, smart. So I guess the question is, what can we do for adults? You know, it'd be great to prevent it down the line, but what do we do even as friends, colleagues, providers, et cetera?
You know, and I hope, how do I do this? Oh, there we go. I hope I'm answering this question. So I say when people ask about that, the main thing is to be a resource for that person. So, and what does that mean? Well, that means that you might think that this person is in a violent relationship or know it, but it is a matter of sticking to it and being a resource for that person, even if they don't want to talk to you about it. You know, despite the violence, they originally fell in love with this person. They have investments with each other in this relationship, and they, you know, people don't often want to be told what to do. And so I think just being there as a friend, saying that you are a resource, you are someone that they can turn to, and knowing that they might not that night, but maybe next time that they do come to you. And the same for physicians and clinicians out there. We talk about asking about domestic violence, and not just asking in a way that says, you're safe at home, right? are everything's cool at home, because that doesn't get at it. We need to ask directly about, are you in a physically violent relationship at home? Or has your husband ever hit you? Or has your wife ever hit you? We need to be direct about that and ask. Going back to my worst case scenario is that maybe they are a tiny bit insulted. Who cares? Best case scenario is they tell you and you get them resources they need. Or maybe even a most likely case is now they know that you're someone, a healthcare professional, that now they know that this is a healthcare issue, and so maybe they see you as a resource and come to you in the future, or they have a friend, because every one of us has a friend who's in a violent relationship. Now they know that you're someone that they can resource and access those types of services. Did I not talk long enough? We could do all my questions, so what else we got?
Do we have any from the audience that I can ask in the
We can
meantime?
play clips from NPR. Go ahead. So adolescents that work and exposed to violence on the job. I have not personally looked at this. I will say that adolescents are exposed to violence, whether they work or don't work, through movies, TV, media, their friends, YouTube, everything in between. I will say that there's probably some jobs that maybe are more likely than others to expose them. But yeah, our kids are being exposed to violence on a pretty much an everyday basis. And then if you look at the really scary stuff, like on 4chan and 8chan, and some of the dark web places, and which the Uvalde shooting was involved in, I think the Buffalo shooting was involved in, you're seeing a lot of that exposure. And is it the exposure that causes them to be violent? Probably not. Maybe a little bit. It's probably more likely whatever is underlying the fact that they want to look at that stuff and be exposed to it, that is the same thing that's relating to this. Thank you for the question, and it looks like I could shut up.
Good job.
Thank you.
Okay, thank you all for being patient as we got that going. So I am Shannon Guillot-Wright, as you heard, and I have been working with Dr. Jeff Temple for quite some time now, and as he said, we had gone to testify in Texas about healthy relationship programs in schools. I also was the founder of the Adverse Childhood and Community Experiences Collaborative for Galveston County. And through both of these experiences, at the time I was still a graduate student, and I was really coming to the realization that a lot of times we would talk about policy, or we would go testify, or we would create a policy brief, but we didn't actually know what was the empirical evidence behind that? How do we actually take those stories? How do we actually take the research and the evidence and actually start to shift policy, right? Even if it takes a decade, what's the empirical research on that? And what I found was that there wasn't a lot of research on it. So today, that's what we're going to talk about, the use of research evidence. It's called URE, kind of where it's been and where it's going. I'm going to discuss the Research to Policy Collaborative, so its background and its purpose, and then using mixed method studies to really try to understand evidence use for policymakers. So as part of that journey that I was on, what I really was trying to understand was, how do we start to move these ideas forward? And so I ended up taking a postdoc at Penn State, but it was located in Washington, D.C. And I did research with policymakers and with other researchers. So I'm going to kind of go into that and then how we can start to use that in our own ways here. So with URE, there are basically 3 generations of thinking on research use. So one is linear, right? So that is, what can we publish? What can we disseminate? How can we, take a policy brief and put it in the hands of a staffer? Linear is not, none of these are bad, right? But these are the generations. So this was sort of first generation thinking. Second was relational. So we realized, okay, just getting a policy brief in the hands of a staffer isn't enough. We need to build relationships. Do we understand their priorities of policymakers, of the practitioners, and communities? So it's this multi-level process. Where we are right now and where the research is systemic. So what needs to be in place to support more research use in organizations? So that's sort of where we've moved. So using science to really improve or create health policies in this multi-level process. And it really requires a good understanding of relationship building, of behaviors, problems, actors, and all the different results that we have. So empirical research on the use of research evidence. So what has been studied was like, what does good evidence use look like? I mean, what needed to be studied? How can better quality use be supported, and what interventions are most effective to deliver this outcome? What types of interventions have been evaluated? So again, there's linear that had been evaluated, relational a little bit, not much, and the systems change not much at all in that space. And then what mechanisms do different interventions employ to generate changes in evidence use outcomes? And then how do we start to actually measure these changes? So that brings us to the Research to Policy Collaborative. So the RPC is a network that was created out of Penn State, and they now work with different universities and researchers across the US. And their goal was really to train researchers, coordinate Hill Day meetings, and foster relationships between the researchers and the staffers. And they were able to secure a William T. Grant Foundation award to study this process through mixed methods. So we had a quantitative survey element to it, and then I led the ethnographic research as part of that. And really kind of overall, participants really enjoyed being part of the RPC, and policymakers really talked about having access to evidence and appreciative of the Hill Day meetings. And then researchers really reported that it helped them learn how policymakers meet with constituents. So what we learned was that policymakers want research, but they want it in bite-sized, or what was called sometimes half-baked forms. And I'm going to go back quickly, and I realize that some people might not know what ethnography is. So in case you're not a qualitative researcher, ethnography is when you really spend quality time with participants. So you do semi-structured interviews or focus groups, similar to what you hear with qualitative research. But there's also an element to participant observation. So I would, go have coffee with the staffers. I would go to their meetings. I would go to briefings. And so I got to understand their lives day to day a little bit better. So when I was asking them questions in the semi-structured interviews, I also had context of what that meant for them. And so I lived in Washington, D.C. for that year that I conducted the research. And so what we learned was that policymakers wanted research, right? So this was across the board, Democrat, Republican, Independent. People were really hungry for research and research evidence. And there were some frustrations when it came to how they could access that evidence. So some people talked about the fact that oftentimes our research is funded by the government, but then there were paywalls to actually access the research. For some people who had built relationships, they would email someone like Jeff and say, hey man, I'm trying to get this article, can you send it to me? So those relationships became important, not only for the legislation that maybe this researcher is working on, but legislation that might even be outside of their scope. We also learned that women and Black, Indigenous people of color researchers experienced more trepidation about the policy space. So I not only met with policymakers and did interviews with policymakers, staffers, but I was also meeting with the researchers who were engaging in this network and trying to build relationships. So what would happen is that we would have these trainings, or RPC would have these trainings, and generally speaking, the men wouldn't show up to the trainings, especially the white men wouldn't show up. Sorry, Jeff. They wouldn't show up to the trainings. They would say, I already know what to do, I'm fine, I'm comfortable in this space. And to be fair, when they went into the meetings, they were typically fine, knew what to do, and were comfortable in the space. Women and people of color oftentimes probably knew what to do, but they just didn't feel as comfortable going into that space without having a lot of direction, without the trainings. So it was interesting that the trainings, it was a result that I don't think anyone expected at the beginning. The trainings ended up actually kind of becoming a level playing field for diversity and men and women to engage with policymakers. And so although the trainings, some of the information, the people who attended the trainings, they already knew the information. But then they would ask, okay, what's it going to be like when we go into the meeting space? What's it going to be like when someone asks a question and I don't know how to answer it? And so it's sort of, giving them kind of power and support in that moment and saying there's going to be people to support you. You're going to be totally fine in that space. So that was kind of a pretty cool result that came out of it. And importantly, because we need diverse voices speaking to policymakers. And so if only one sector of our society feels comfortable being in that space, we need to make sure that we're doing something to level the playing field and so that it's a more equitable experience for people to be in those spaces. And then also, policymakers were more likely to listen or reach out to someone that they had a relationship with over a cold call or email. I think that's something that most of us could probably experience ourselves as well. When you have relationships with people, it really starts to change that dynamic. And so, whether it's having a healthy relationship in your school setting, or also learning how to have, healthy and productive relationships with staffers, and even staffers who you might not agree with, you might not see eye to eye, but they were still, wanting a lot of this evidence. And, for those who haven't engaged in the policy space as much, oftentimes staffers are younger. Some of them are interns who are barely, being paid to, rent a, apartment in DC. There are some more senior staffers, but even they are typically pretty young, pretty fresh, and there's a lot of turnover within that space as well. And so really being able to, and they also are pretty open to ideas. It's their job usually to be sort of the face of the office and to be pretty welcoming and to listen to different ideas. And so whenever you could engage, and again, going back to the previous slide of actually presenting evidence in a way, in a format that was helpful for them, not helpful for you. One guy talked about, he had his PhD and he was the chief of staff for one of the senators. And he talked about how someone sent him his dissertation. And he was kind of looking at this like, no one's even read my dissertation. Like, I barely read my dissertation. I'm not going to read your dissertation. But that person on the other line was probably like, man, I engaged with policy. Like, I feel good today. I sent this staffer my dissertation. It got deleted. So it was, what are the ways that you can engage that's helpful for the policymakers? And that was really important. And then also academic systems are not set up to encourage policy collaboration. So this goes back to the systemic change as well that we see. And so there's systemic change that needs to happen on the policy side when it comes to how interns are paid. And because of that turnover and being able to support people who want to engage in policy but can't, go live basically for free in DC. But on the other side, for academic systems, we really need to start thinking about how we're encouraging this policy collaboration. We do this research, we publish in, high impact journals, and then oftentimes that's it, right? Like our friends will read it, like maybe my dad will read it if he's feeling nice that day. My mom definitely isn't gonna read it. And so how do we start to really think about the system level changes that we can support people? Because this goes back to the other slide as well, that many junior researchers had a harder time collaborating with RPC and being part of the network because they didn't have as much discretionary funding. They they didn't have as much time to take off. They may have had higher, teaching loads or, all these different factors. And so how are we making sure that we are including everyone in this process? And, I would also say that changing policy is not just meeting with the staffers as well, although this study didn't go into that, but it's also the narratives that we're telling and that the media is picking up. So although Dr. Temple was making lots of jokes about being on NPR, that's actually incredibly important, because if we can get on NPR, I think he's even been on Fox News maybe, if you can get on these stations that different people are listening to and start to craft a message in a way that they can hear. The mother earlier, who was talking about how she lost her son and how she had to craft her message to really reach people who may have different views than her. I think it's really important when we are wanting to talk about changing policy, we also need to think of ourselves as the democracy that is voting in those policy makers who will listen. Oh, and I already went through that one. Policy systems are not set up to encourage research collaboration. So, for instance, sometimes reports, briefs, policy briefs, they would need them within 48 hours. And so, you'd have to have a team who's, really set up to be able to make that happen. We do have that, the Center for Violence Prevention. We have a team that's able to turn around briefs really quickly. And because of that, we've gotten to build some really great relationships with policymakers. But not everyone, has that as well. So we need to think about systems change on both sides. So recommendations, keep your message simple. Whenever I've testified before, we've seen somebody, literally print out their PowerPoint slide and then read the PowerPoint slide. That's not going to cut it, to be very frank. You want to keep it simple and keep your message engaging. Have your expectations, right? So whenever we met with staffers, sometimes it would be a 15-minute meeting in a hallway. And there were some people who were like, I'm the vice chair of this, and I flew to DC, and I'm having a 15-minute in a hallway. I get it, it can feel weird, but that 15-minute meeting in a hallway can actually be really beneficial and can start building the foundation for these relationships. And so really knowing your expectations, having an awareness of what the space is like, so that you aren't taken off guard and that you can still create this process. Really, again, long-term goals and building relationships. Policy is funny in that they want something within 48 hours, but then it might take 10 years, 20 years to get something really meaningful push through. So having those long-term goals and, keeping with it. And then, just being a trusted resource and being able to, create policy briefs, share contacts. Don't be afraid to engage other people in the process because no one can do it alone. So if someone's interested in a certain topic, hey, a colleague of mine, at Baylor studies this specifically, and making sure that we're connecting people. And then again, giving testimony. You can even give background and strategy. So maybe you are super shy and you don't want to have to testify. You can still meet with people and, be able to give that research and evidence background because again, people are really hungry for that. And then here, this is an article that we just recently published, Improving the Influence of Evidence on Policy Creation. And it kind of goes into more detail about what I talked about of studying that research to policy collaboration. So thank you so much. Thank you to William T. Grant Foundation. And sorry, quickly to Max Crowley and Taylor Scott and Catherine Oliver. Max and Taylor were the co-founders of the Research to Policy Collaborative and opened themselves up for critique, for evaluation, because they wanted their program to be better. And because of that, they're one of the only research to policy groups who has actually been empirically studied. So we're really grateful that they love science so much that they believe in seeing the good, the bad, and the ugly. And then Catherine for ethnographic support.
Do we have time for questions? Okay, great. I'm going to start it off while I read these, but Dr. Guillot Wright. So one of the key things that I've taken away from this conference thus far is that in order to be successful, you really have to understand the viewpoint of your stakeholders. So you mentioned kind of knowing where the staffers and policymakers are coming from. Dr. Temple kept emphasizing it's fiscally responsible to engage in these prevention programs, but what is it, as someone who has met with staffers before, what is it that sells them the most?
That's a great question. So I think being authentic sells people, really. So you don't have to change your view. So when we say, kind of walk in nonpartisan, that doesn't mean that you have to put yourself outside. Just really being willing to engage long-term in the process. So, if a different staffer ends up having to come in, sending an email and saying, thank you so much, I know things happen, would love to catch up by phone. So I think really having that sense of understanding, and then really importantly, is many times whenever even researchers are meeting with staffers, oftentimes it's part of maybe a professional group, and there's some lobbying involved in it. And what I'm presenting is actually the opposite of that. And so when we talk about advocacy, it's not lobbying, and so it's actually something you could do, on the dime of the university if you're presenting evidence to policymakers and presenting that research in a pretty neutral way and saying, look, I've done this study and this is what the evidence says, and really listening to staffers and saying, what is it that you need? So I know you're interested in, stopping, in reducing human trafficking, right? And maybe it's someone that you disagree with on other areas, but that's something that you can agree on. And so what is it that you need so that I can help you move that forward? And so building that relationship and listening instead of always asking, I think is important.
Great. It sounds like my question was actually in the same vein as several of these questions. I may paraphrase one of them, which is maybe for both of you, what evidence might be compelling to policymakers that mental health is not responsible for gun violence? And how can we convince them?
Yeah, this is a frustrating problem for me on several levels, and so I'm going to use this as an opportunity for therapy. is, on one hand, there's these folks that use mental health as the boogeyman, and we need to put all these resources into mental health and mental illness and make everything better. Great, do that. But on the other hand, now, to be quite frank, in Texas and some other states, socio-emotional learning is now a bad word, and we can't teach our history in CRT. And so it's just really frustrating that you say on one hand we need these programs, it's mental health, but on the other hand, we're going to take everything away from you to be able to deliver this. So, instead of answering your question, I just went on a personal vendetta against people, and I apologize. So, I don't know. maybe 6 years ago I would have said to show him evidence, and I'm hoping that Dr. Guido Wright can save me here, because maybe I've lost a lot of hope.
I'm going to hopefully give you some hope. Something that I found kind of shocking, and it was a good reminder for me when I was interviewing a staffer, is that he said, what you hear on the news is like 1% of what's actually going on. And a lot of the staffers are working together, and they're working really hard together across the aisle. So the people who are, the elected officials, I'm not taking away from the work they do, and I'm also not taking away from the harmful narratives that they are perpetuating. But at the same time, there is a lot of work that's happening that none of us can see. There's a lot of bills and legislation and policy that, we don't even know about because we're not in the day-to-day. And so I would say to try to, fight against that 1% that we are seeing that is really detrimental and has, created some very real problems for us as a nation, but also to not lose hope in the other 99%, and that there are people who are trying to work together.
Yeah, I would say to add to that, I think Chris Murphy, who's out of Connecticut, has done a really good job of walking the fine line between, the need for mental health resources and gun control. And, I think he's done a great job of saying, we're in a unique position now where we can get billions of dollars to help this mental health care. So despite my frustration, I shouldn't just completely be dejected, because that is awesome, and we are in a really cool place right now where our country might actually see resources for mental health that we've never seen before.
There are a few questions here about kind of how those who are in leadership can support their teams. So, for example, what about interventions to help maintain healthy relationships for our colleagues or our faculty at home? Does longer maternity leave help? Do other wellness type programs help?
I'll jump in there and say one thing that I think that gets at with some of the maternity leave and paternity leave is that this is going to involve structural changes that if we want to reduce, so let's go back to gun violence, if we want to reduce gun violence, we have to increase livable wages, affordable housing, child care, all that sort of stuff. If we do a good job of addressing that, we will reduce gun violence and all forms of violence. Back to the first part of your question, yes. Healthy relationship skills are so essential for everyone, not just kids, right? No one in this room were ever taught how to be in a relationship. Not one person.
I learned it from Saved by the Bell, so you take that back.
I've been compared to Zach, so it's fine. But right, so and to that point, how do we learn to be in a relationship? We learn everything. We learn math, English, writing, all that stuff, how to dribble a basketball. But how do we learn to be in a relationship? By media, which is, with the exception of Saved by the Bell, is terrible. Or we learn from our friends who are equally as bad at it. Or we learn from our parents, which some of them are good, but some of them are terrible. Or even well-intentioned ones, I argue in front of you and then make up elsewhere, and you don't get to see how to resolve conflicts. Or they do it by trial and error. So, I reiterate that as much as I can. We need relationship skills, all of us.
All right, and then I guess since we only have 2 minutes, I'll end with, how can we support enhancements to our teams to help translate our research to policy?
I'm sorry, read that again.
How can we support enhancements to our teams to help translate research to policy? And I'll add in there, since I'm a division chief, how can we support academics to engage in advocacy?
So something that's really practical is, and this is something that whenever I was working under, so before I became vice chair of research for family medicine, I worked under Jeff as an assistant professor. And when I was creating my, plan for, appointment and tenure and promotion, one thing that he said was, when you talk about education, don't just talk about the courses that you're teaching to students, but think about education very broadly. Think about education, you're educating staffers, are you educating other researchers, right? And so something really simple and practical like that, which is, really a mentorship opportunity to say, first, also, that's without saying it, that's saying, I support these activities, right? Two, it's saying, this is a way, until we can change the system where it's explicitly highlighted, this is a way to still show all the work that you're doing that sometimes doesn't get counted in the same ways. But then, I would also say, being an advocate at, at that system level, in the C-suite, as we say, and being able to really push, APT forward, that, these are issues that can, that need to be focused on, and that our research needs to move to policy and it needs to move to practice, and that, tenure shouldn't just be, have you published an article, but have you published it and how has it actually benefited people?
Sounds like you really had a great mentor. Why did you leave? Why did you leave him? That was a
Which
bad
I would
decision.
also add, the research to policy and practice, I think, is an ethical issue as well. And, there might be medical ethics, people, ethicists in here. And for me, that is an ethical issue, that our research, if it's not actually benefiting the people, then it's, then what was the point?
All right, and I'm sorry I didn't get to every question. We'll end one really, really quick one, which is, how many times were you both on NPR?
It's a great question, actually. So if you listen to Ernie Manous, Town Square, I'm on there about once a week. And then I was just on the national NPR earlier today. I'm not sure you guys knew that.
I've been on the Houston one once. I haven't made it national status yet, but.
Thank you all.